back to Meds Made Easy. My name is Tarun Verma. Today, let's dig right into it. Let's go into Olanzapine. This is a very, very old medication. You generally don't see it a lot in practice anymore. It's so old, I don't even know what the brand name of this medication is. So Olanzapine, it's used for schizophrenia and bipolar disorder. It's a second-generation antipsychotic. Officially on the books, the mechanism of action is unknown, which is very not uncommon for drugs that work in your brain, but it's always stuff that makes me go, well, how do they not know how this stuff works? But they think that it works by antagonizing your dopamine receptors and then your serotonin HT2 receptors. So giving you the chemical balance that you're looking for, right? All of this is kind of done by your doctor's offices, regulating your brain chemicals that get you the desired effect that you need. Let's see here. Comes anywhere in a 2.5 dosage form all the way up to a 20. The dosages, the variability is so wide, you know, it's used a lot more on the clinical side when it comes to like injections and things like that, especially when you go to mental facilities and things like that, they use it a lot. But that's generally, again, the injection form. So, and it's very variable on how you take it. So again, I'll let the doctors take over from there. As far as what we're concerned on the pharmacy side level, it does have a black box warning for dementia-related psychosis in the elderly. So if you are elderly and you have questions about it, please leave comments down below. I won't go into it just because it'll take up too much time. But if you're not elderly, then you don't need to worry about that per se. Let's see here. For lactation, you should always proceed with caution. There's limited data on this, which means we don't really know if it's safe or not. So again, you have to defer to your OBGYN or the pediatrician, whoever you're using, for information on whether it's safe to lactate breast milk with this medication. Pregnancy, you have to monitor your glucose. This is a medication that has a wide variety of side effects. That's kind of why we don't like using it in practice. Just because it can do a lot and it messes with your blood sugar. So when you're pregnant, obviously that's terrible because if you mess with your blood sugar, you're looking at gestational possible diabetes. So we don't want that. And then potentially there aren't a lot of heavy evidence for it, but there may be a risk in the third trimester. Again, I don't want to sit there and say, hey, this is what happens. You need to refer to your doctor. There's just not a lot of evidence done on this drug, not a lot of trials done. So we just don't really know too much. Let's see, it's heavily processed by your liver, so your doctor needs to know what other medications that you're on that could be going through the liver that could cause problems. Let's see here. Yes, side effects. I'll put them up right here. And really, I'm gonna touch on just maybe about 3 or 4 side effects here that we need to talk about. A lot happens. That's why we don't like using this drug if we don't have to. You'll have things like extrapyramidal symptoms or tardive dyskinesia, which all relate to losing momentarily muscle function or muscle tone in your body. So you'll have facial jaw movements that are like you have no control over them. Your hands just might kind of move. Your muscles in your body just kind of might move randomly. Those are side effects we don't like. We don't want to see those things. That's why we tend to try to use different medications in general. If it bothers you too much, you need to let your doctor know because you need to get switched on something else entirely. There's also weight gain being a bigger issue with this medication. We've seen a lot of the population, a lot of patients come back and they go, I've gained like 10, 20 pounds, but I don't understand why. This medication will kind of do that in just a few months, just real quick. So again, if that happens and it bothers you, then you need to go back and talk to your doctor about alternatives. I think in a nutshell, that kind of covers everything we're looking for. Again, we don't see this medication too much in retail practice. You see it more on the clinical side. Again, facilities, you generally use this medication more, mental health facilities, psych wards, things like that. You see it just a little bit in practice, and it's really more so with like the older doctors who are comfortable using this medication. A lot of the newer doctors kind of keep up to date, so that they're kind of prescribing different things. But again, when it comes to schizophrenia, bipolar disorder, they are very difficult, complicated disease states, and so kind of whatever works. that's what we're looking for. Just whatever works, that's the best we can hope for. So again, guys, if you have any questions, concerns, leave them down below. We'll address them the best we can. Give the page a follow. We're always trying to come up with more and more videos. This was actually a viewer request, so guys, keep them coming. We'll try to get as many videos on this page as possible. We just want to help people. So again, thanks for tuning in, guys. We'll see you next time on Meds Made Easy. Bye.